Hi everyone, my name is Mo, and I'm making this video to reflect a research paper I wrote in my IT 104 class at George Mason University titled Assessing Robotics in Healthcare Hospitals and Pharmacies. The purpose of both the paper and the website this video will be on is to review the current issues, security aspects, ethical or social concerns, and future uses of robotics in healthcare, in things like surgeries, pharmacies, or hospitals. It's a relatively new topic of research and experimentation that leaves it open for new advancement, but also arising concerns. Having said that, though, most researchers in my paper, or the research that I did, agreed that the use of these robots improves overall workflow, patient care, and cost effectiveness of healthcare facilities. This video and the paper is not limited to specific robots, but I've included some that I think are most interesting or beneficial and most well known. So first, I have the Da Vinci surgical robot, which is just one example of how robotic-assisted surgeries overcome limitations surgeons without robots previously had. There's another surgical assistance robot called the McSleep that administers anesthesia to patients before surgery and monitors the patient's brainwave patterns, heart rate, and blood pressure, and it actually calculates correct dosages more accurately and faster than humans can. Another robot is called the Probot that carries patients. It can assist disabled or elderly patients, and this kind of robot would most likely be seen in places of rehabilitation, physical therapy, and even transportation around the hospitals themselves, from room to room, from bed to bed, things of that sort. I've also included two pharmaceutical robots, and one is an automated counter that dispenses the right medication and the right amount into the correct bottle, and that's actually would be in the pharmacy. And there's also a robot in a hospital setting that is basically a robotic pharmacist that fills and dispenses the correct medications to the correct patients and can travel all around the hospital, which overall increases that workflow. And lastly, one of my favorites is known as the Vigo robot. It actually allows two-way audio and video communications for people in different rooms, different places, and even around the world. And I think it's an amazing advantage to the healthcare systems, and I definitely hope more facilities are able to make these robots improve their connections between patients and improve patient care. This picture that I included in the video was actually derived from a website that a mother was saying she could communicate with her child that was quarantined and otherwise couldn't see anybody. So I think it's a huge progress from where we started to where we are now. And I hope that more hospitals are able to use them. And that is all for now. So I hope you all enjoyed this, and thank you for watching. And I've included my references with links to the websites that I got these images from. And again, thanks for watching.